else would want to add into this idea of a national strategy?
Well, I think it actually is an international effort. I think one of the things that we've seen is we're in unusual economic and political times. And so we found, from our perspective as a nonprofit, in setting up the NICEF Institute, which is our own laboratory, that there really is a need to be able to have funding and private entities that can do some of the very high-risk work that is simply not going to be something that is going to fit into a more typical grant system, and is probably going to be too high risk for a financially driven or sort of having fiduciary obligations to investors for a public company or a biotech to take on. And so I think that because it's such a new field and so critical, because none of us can live with $1 billion and 12 years to develop a drug that in all likelihood will fail, right? 95%, 98%, 92%, you can pick your percentage. So we have to have a new model. And in order to do that, I think we need this kind of protected, pre-competitive space. And I think if we could get agreement on pre-competitive space in this area, we really could make progress for sort of the ultimate shareholders, or who we consider the stakeholders to be, and that's the patients.
So obviously, I think also this is it's an international or global question, and we have to make sure that the field is progressing globally, and there are some standards worldwide. But of course, the US is a leader in the field, and hence a national strategy in the US is very important and can set the precedents for other countries. And that's why also Roche is supporting the Alliance for Regenerative Medicine and is in there and working with ARM to set this up.
How do you, maybe just to frame the need then, so the headline is Geron basically abandons its stem cell strategy. That's the headline. And if you look at then both sides of the table, if you will, one side of it is the FDA and the like, which says there's just unanswered scientific questions. The guidelines, the framework is unclear because the science is unclear. And on the other side of the table, you have a private company with its own investors that look at this uncertainty, and it's very hard to pool capital into that equation when you have uncertainty both in the science and in the regulatory framework. What do you want? What do you want to see happen here to alleviate what just seems to be where we are, that there's going to be this uncertainty? What could happen to change the uncertainty? Any of you?
Okay, so maybe from a big pharma perspective, I mean, it's just, so on top of what you said, there is also the financial environment that at the moment is not really supporting, these more risk-taking approaches, obviously. But on the other hand, we can just, nobody, either it's a big pharma or biotech company, we can just not afford of running into big failures in this field, because it's detrimental for the field. And therefore, we have to take it step by step, and we have to sort out the science. I think we are, from our perspective, we are not there yet, but we are making very good progress, and this is needed. And I think it would be a mistake now to rush into things, of course, but there needs to be a support, a financial support. But I think this is a general issue at the moment. I don't want to belabor this too much, but obviously from the financial environment that is not favorable. It has nothing specific to do with the stem cell field, but obviously the stem cell field is maybe hit most by these effects, But again, to make the point, I think we're making progress, and we have to be a little bit patient also, because it's a serious business we're in. We can't rush into things.
So your view, just to build on this, is that the inevitable setbacks that we see in this field are natural, it's okay, and we stay with it, and we're getting to more certainty or clarity as we go through this. But, so you're hopeful? I mean, you're not too...
We are absolutely hopeful because, I mean, from only by the failures, I think, we will learn. And every failure or every setback will bring us forward, right? So that is basically our approach, because science is based on going the wrong path before taking the right path, you know? So, but then again, Geron is not a failure, right? I mean, from our perspective, this is a strategic financial decision of a small biotech company who has to place their bets, you know, more focused rather than broadly. But of course, I mean, the approach they have taken is, on top of that, is in regenerative medicine and cell therapy, they have gone to the pluripotent approach, which is, you know, the extreme angle of the whole field. So, you know, it all comes together there a little bit, almost.
Okay, so some of it was just their own choices, and some of it is the times we're in, but overall, some certainty and knowledge came out of their own efforts that really inform your actions at Roche and others, is your point.
Absolutely, exactly. I mean, even though Geron pulled out just now, I mean, what Geron has achieved so far with the FDA, setting up preparing a regulatory pathway, getting into the clinic with this cell therapy approach, with pluripotent stem cells. From all of this, we learned a lot, and from this we can build on.
Well, so Mahendra, you're now responsible at the NIH for bringing more certainty here to allow more capital to flow into regenerative medicine. How do you build off of Matthias's comments then? What is the NIH doing to bring more certainty so that the next Geron can be ever more successful?
The government really can't do this unilaterally. So what the government needs to do is poll people first and understand what will satisfy folks in terms of certainty and how they want to move forward. And so that's been what our first target is. We recognize that there are sort of 4 different aspects of uncertainty in this sort of new field. One is the technical uncertainty. There is the financial uncertainty that you have, and there's the regulatory uncertainty, and then there's the overall economic sort of environment. The economic environment, NIH itself can't do a whole lot about. In terms of the technical uncertainty, we can first understand what are the big issues, and then make sure that those are resolved in some fashion. And you heard from several people here that for those technical issues, sometimes there's no single entity other than the government who's willing to do those sorts of basic experiments, or provide the controls, or provide the standards, or whatever else that may be needed to be able to do that. On the financial side, it's become pretty clear that there has to be some kind of partnership in terms of being able to move these things forward. And there, what the government has tried to do is say, which are the paths which are of really high risk to private industry, and is there a way that we can find alternative ways of either providing financing, or providing a fast track, or shortening the paths to the clinic, or extending patent coverage, and looking at all of those pieces in terms of trying to mitigate the uncertainty that would be there for industry. And on the regulatory side, there has been a really important piece, which, as you heard, industry has been an important role player in terms of being presenting the processes, but working to make sure that those learnings don't remain with a single stakeholder, but that they're widely distributed, and that we learn from people who move forward. And that's been an important role that the government has tried to play in terms of mitigating things. And we think it's this whole process together which will help move the field forward.
You know, the title of our session is what will happen over the next 5 years. So maybe just focus in on one of